So I'll formally start then the meeting. Well, welcome to all those who are here. We have sign interpretation. We also have captioning for those who want it. And I assume that those who wanted that have been told how to get the box with the captions in. We are going to record this and put it up on the website. So is there anyone who has objections to that? If they can let us know, and we'll make sure their bit is cut out, but I hope not. As you're all representative people, we would expect that what you say would be acceptable to the world community. And just a reminder that it is a public thing, and therefore, you know, only say what you think is acceptable in the public realm. We think it's really important that we have these summits and webinars to keep everybody connected during this pandemic, which is far from over. And I will say a little bit more about that in a moment. So the program then is a number of selected presentations, questions to those, and then we will break into five regional groupings, which we've allocated you to. And the people, we've also allocated people to be the conveners of those. If they don't turn up in your room, then can you appoint from amongst you someone to chair you? And the issues that you're looking at, I will tell you as you go into those rooms. So you'll have about 25 to 30 minutes in the rooms. And then the rapporteur will bring back the key points from that. And then I have a few suggestions for us to agree taking forward. So if I can start by sharing where we are up to. Can everyone see this now? Can somebody feed back to me that they can? Gemma, can we see this?
We can see it, yes, absolutely.
Okay. So this is the data we put up every week on our website, but I've done something new here this time. What we've looked at is the number of cases in the last 2 weeks up until the 4th of June compared to all the cases that there have been in the country. And therefore, what we get from that is that 51% of the red is over 50% in the last 2 weeks. So this shows that it's very much still a live pandemic. And if we go down the list there to the red ones, you can see Bangladesh, Kenya, Malawi at 80%, Mozambique, and I think, and Uganda. So those are really hot spots with more cases in the last 2 weeks than really in the rest of the epidemic. Then the second lot are 20 to 49%. And we can see there that we have Botswana, Cameroon, Ghana, India, Nigeria and Pakistan, Rwanda, Sierra Leone, Sri Lanka, small numbers of cases, but nevertheless some, increasing on St. Vincent and the Grenadine and Eswatini or Swaziland and Zambia. Then still not really okay, above 10% in the last 2 weeks are the blue ones. So we can see there that we have Canada with quite large numbers, as you can see. So these are not related to the numbers, they're just the percentage in the last 2 weeks compared to all cases. Guyana at 18%, Jamaica 10.3%, Malaysia 12%. Malaysia had dropped down, but it's come back up again. And Singapore, which had also more or less eradicated. The second spike is already underway in some of these countries. And the United Kingdom, which has the highest fatalities within the Commonwealth is likely to top 40,000 today, according to government official statistics, but really still in a large number of new infections being found every day. And this is the point, that really the protection measures need to still be in place. People need to be washing their hands, using masks, isolating and lockdown. And there is, of course, a problem that many governments are trying to push for breaking the lockdown before it is actually safe. And we need to be lobbying where we have these figures. I would say anyone in the blue, red or yellow zone should not be coming out of lockdown. Only those below 10% should really be in this. And we can see many of the small island countries have 0 or very low rates, and that's a feature of their geography. But it's also, some of the countries have actually done very important measures to get those figures down. So this will go up on the website. The table's already up. The last column I did this morning, so that's for something to share. I also have PowerPoint. Where's that gone? Yeah. From the survey that you sent us, we've analysed some of the key issues that are coming up. Generally, it appears, despite us getting off to a good start with the principles and the policy statement, which most of you sent to your governments, only very few report that they are actually being properly consulted by their governments, amongst them Malaysia and Guyana, but most of you say it's not very good or not at all. Issues, a lack of information and access has been addressed in most countries, but there's still an issue of stigma where spreading of the virus is being associated with people with various impairments, and all sorts of myths are being said there, and that needs to be challenged with public broadcasts that we need to push governments to. Lack of support for personal assistance, food and welfare, reports from many parts that disabled people are going hungry, and what welfare measures there were before are not in place. Many people living from hand to mouth on food banks and handouts, and of course quarantine arrangements and lockdown mean that people can't get to this. It also means that people can't get to the medicines they need for their long-term conditions, and the usual medical procedures that many people living with impairment need, they can't get to. Routine medical procedures are not going ahead. A large impact of unemployment on disabled people, many of whom operate in the casual sector, street markets, small businesses and so on. These have been hit very hard. A lack of access to online schooling, with most places having closed their schools, though now some opening. The problem remains of a lack of access to online. We need to be pushing governments to provide online support for disabled students, and if necessary, getting internet access to them. If there's no electricity, then getting solar panels, etc., so that they can actually function. And many disabled students will remain in lockdown, and therefore, unless we can get this for them, they will be completely cut off from what is essential for them. There also coming across is high fatality rates, particularly in the UK, for instance, 4 times as high for people with learning difficulties. And then, of course, many people with chronic conditions are, of course, in the high fatality group. And shielding for this group need to continue in any of those countries which are blue, yellow or red. And we need to be arguing for this very, very strongly. Okay, so that's my introductory comments to where we are. So if we can now go into taking our comments from, where are we? Gemma, over to you to put the films up.
Okay, so we're going to play Rachel's video.
Rachel is our chair, and she's from Malawi.
When we circulated the statement which we wrote as a CTBF to all the Commonwealth countries, we made sure that the statement was published in the local newspaper. And because it was published in the local newspaper, Many companies tried to respond to the call, and one of the people who responded was Malawi Union of the Savings Cooperative, who said that they have to work with us and make interventions on the COVID-19. And what we have done is we went to some of the districts in the country and distributed some of the items like soap, sanitizers, and washing basins. And we raised the awareness on COVID-19. We did this in all the 3 regions of the country. As you know that Malawi has got 3 regions, that is the north, the center, and the south. And in each region there were about 50 women with disabilities, which is making up to 150 women whom we reached with the message on COVID-19 and received this is support from Malawi Union of the Savings Cooperative Organization. And we have also been to the national television and the national local radios in the country, where we have been sending out messages on COVID-19, and the responses has been very good. And we have been also calling upon government to make sure that whatever interventions that the government is doing, they have to include persons with disabilities, that the messages have also to be in all accessible formats where all the people with different types of disabilities can be reached. And we have also included all the stakeholders, different DPOs whom we are working together, mobilizing the voice so that all the voices from all angles they have to be heard. So in short, we are saying that in Malawi at the national level, this is what we are doing, working in collaboration based on the statement that we have been issuing in the local newspapers. And even in across Africa, the issue is the same, because we are getting some feedbacks from other countries, and the things that we are doing in Malawi are the same that is being done in other countries. It's just that we cannot be able to trace, as you know, that with this lockdown, we cannot be able to engage with many of the people in the other countries to find out how much they have done it. But the circulation of the statement was done. We sent it to all the member countries in the Commonwealth in Southern Africa, and even we used the Africa Network Evidence to Action, which is an Afri-led organization which deals with research, and we segregated that, and it was also segregated to different institutions to make sure that they also speak the same language, calling upon the different governments and all researchers to make sure that the issues of COVID-19 does not leave anyone behind. So in short, this is what we have been doing in Malawi in order to raise awareness on the COVID-19. Thank you.
Great. So that's really good. If people, that was quite fast. If people miss it, they can go back onto the recording, which will be up on the website. But we are also writing notes on the presentations, so that will be put into the report that we're bringing forward. Could we next bring up Tandy Mufolo, who is from Disabled People South Africa, and is one of our 2 vice chairs of the Commonwealth Disabled Peoples Forum. Can we do that, Gemma?
I'm really sorry. I made a mistake with this, and I accidentally deleted it. I'm just uploading it again to my drive.
Okay. Let me
just give me 1 minute, or
okay.
maybe I mean you can carry on, and it'll be ready for when you want to do it next.
Okay. Well, I'll then come to Sarah Kamua, who's from Disabled People Kenya, and is also a vice chair. Sarah, are you on? Yes, you are.
All right. How are you all? My name, as you've heard, is Sarah Kamau from Kenya, from the United Disabled Persons of Kenya, which is an umbrella body for all the DPOs in Kenya. About COVID-19 and what has happened in Eastern Africa, the issues I got from Tanzania and Uganda somehow are interrelated with what is happening in Kenya, and so I summarized them to to share cross-country issues, cross-cutting issues. And one of the major issues is language. And initially, the language barriers were there, and sometimes are still there, but they have been looked into, and most television stations now have sign language interpretation and captioning on some of the articles that or some of the programs that they air. So persons with disabilities are able to follow on the information because the right language is used, and persons with disabilities are able to follow. Then we have disabled persons have been involved in giving their views so that the government can also, as they are incorporating the response for COVID-19, they are able to highlight and prioritize issues of persons with disabilities. We have, like Richard said, some of the things that I put up from the questionnaire that was sent. There's loss of livelihoods because most persons with disabilities do businesses, small type businesses, which they are not unable to do now because of lockdown, and they are not able to move because of the curfews also, and that has really impacted on their livelihoods. There's also the restricted movement. Sometimes they want to move from one point to the other, but because also of the challenges of transportation, which is not easily accessible now because of the number and the measures that one needs to put up, like wearing masks and sanitizing, not really being able to use that because of their disability. The disability issues really are impacted as far as transportation is concerned, and so they are affected. Also, inaccessibility of regular healthcare is required by some persons with disabilities who have special needs like physiotherapy, or children who have cerebral palsy and other physical disabilities, has been affected and hampered because of the lockdowns and the need to move from where they are to hospital. That has been an issue. Also, activities for organizations have now gone online, and therefore it is becoming difficult because internet accessibility is not readily available to everyone. And so people are left out, especially persons with disabilities who are at a low cadre, and they may not be able to afford like internet services. So another issue is about school also. Learning has continued in some online platforms, and this has also affected the way persons with disabilities will catch up with their learning needs, as they are not able to follow the education or the learning online platform. So those are some of the things that are happening, and the lessons we have learned is that there is need for more hygiene to be given to persons with disabilities, like issuing of the sanitizers, and even having extension workers to go to where they are to give them the services from their homes. And that also means that social distancing cannot be readily attainable for persons with disabilities because they need people around them to help them do the things that they are supposed to do. So we need more support even on education, so that learners with disabilities are able to have that special attention and be prioritized by government. They find ways of how to make it easier for persons with disabilities. Also, women and girls with disabilities have had issues of responding to their needs, as domestic violence has also gone up. Women and girls with disabilities are some household heads, and they need to be able to make ends meet, and their livelihoods have been affected. And so the need for even the way the government has given more cash transfer in Kenya, for example, so that persons with disabilities are able to be cushioned against not having to meet their needs, but that is still not enough. So I want to say that those are some of the lessons we have learned, and maybe more will be clarified maybe during the question and answer time. Thank you.
Thank you very much.
Hello.
We'll do Tandy's in a minute, but I'm conscious that the last two presentations have been from Africa. So let's move over to Asia. and we're pleased to have Arman with us, who is CEO of the NCPEDP in India, which is a network that coordinates a range of disabled people. And they produced an excellent report, which is up on our website, called Locked Down and Left Behind. And I'd like to ask Arman to talk to us about the main conclusions of that for 4 minutes, please. Thank you.
Thank you, Richard. Hello, everyone. I'm not sure how many of you have seen our report, which is on the CDPF website. We did this report where we talked to about 1,067 disabled people across the country directly and asked them very specific question on their lives, which was affected with the lockdown and the COVID-19 crisis in the country. As I speak, the numbers of cases in India has gone up. We have about 200,000, 273 cases and about 6,367 deaths recorded till today. Having said that, till date, you have no communication from the government of India, which talks about, when we started, there was all the communication which has been issued by the central government is inaccessible in format, quite similar to the presentation which has been made earlier. Till date, you do not find any economic measures being announced for people with disability. There was an announcement about of 1,000 rupees, which is about less than $10 for people with disability, to be paid in 3 installments in 3 months. Only a few people have been able to access to that money as well, because there are multiple gatekeeping, like to be registered on the below poverty line data, and access to have a disability identity card. Essential services like ration, food, shelter also has been an issue. People are displaced, and all of a sudden they have lost their livelihood, and access to healthcare and medical aid is also a huge concern for people with disability across the country. And specific to the COVID-19 hospitals, you do not have any information if a person with disability is infected. What is the testing process? What is the hospitalization process? Are they accessible for disabled people or not? People have raised issue, the people especially with spinal cord injury, people who are high support need, they have not been able to access their caregivers or service providers, and that has really deteriorated some of the cases of people who have bad bed sores and so on. And similar issues has been shared by my other panelists who have spoken here. There are helplines run by various civil society organizations, including people with disabilities organizations, but there are no streamlined system where you can get information to what you need. Currently, the country is slowly getting unlocked, even if the number of cases are going high, and also people are getting relaxed. So the services which was being provided for people with disability in terms of providing food and ration is also going thin, and it is limited to only containment areas where these deliveries are made at the doorstep. And mind you, this is also done mostly by the civil society organization, barring a few states. There is a demand which we have raised with the government of India to raise the minimum to announce an economic rehab package for people with disability to be at least about $70-80, about 5,000 rupees, Indian rupees, for every person with disability who doesn't fall under the income tax bracket. To ease down the gatekeeping of certification, because majority of people with disability in this country doesn't have identity card, so that is also hindering the process of getting access to essential services or any kind of help. There is a discussion which is on right now about how do we make the current education system which are going online accessible for people with disability. There is a meeting on Monday, which I am also being invited. It's again a webinar kind of a meeting online, and this is the first time that we have been invited to participate and give our points across. But over and all, in the main concern remains that the government has kept disabled people's organization out of any discussion when it comes to Ministry of Home, which is deciding on the lockdowns and the measures and the guidelines that are being issued. Communication remains inaccessible for people with disability. Even when the Prime Minister speaks, the sign language interpreter is not in the same frame on the main channel. It is on another channel which you have to go, and a very small window of is there which a sign language interpreter is interpreting in a wrong way. So that is the feedback that we have received, and very unfortunate to be treated like a second-class citizen in this country. And whereas the very strong law exists in India, the Rights of Persons with Disability Act, and it very specifically talks about a disaster situation, how disaster inclusive risk reduction can happen, and it has completely been looked away with. And this is very unfortunate, because this is something being issued by the government, and government itself doesn't look into the situation. Right now, the disabled people is demanding a meeting. We have with the Prime Minister. We have reached the political parties of opposition, and also other parliamentary committees where we have given our memorandum and sought that they raise issues of disabled people in various parliamentary committees, which will meet in next fortnight, from Ministry of Home to the Ministry of Finance to Ministry of Social Justice. And we are using all tools of advocacy. It's from media. There are multiple litigations in various courts across the country, at least 4 I know of. And there are some good orders from the court directing the government to immediately provide relief to disabled people. But over and over.
Please wind up your comments.
Yes, yeah. So, but the situation of disabled people continue to remain green. Thank you so much.
Thank you very much, and thank you for the report, which is on our website. For you and everybody else, as you are engaging with government, it would be great if you keep the Commonwealth Disabled People's Forum in the loop. Just send us copies of things where you're making progress with talking to government. So that would be really useful. I'm going to go now to Edwin from Nigeria, most populous country in Africa, the Commonwealth, with more than 200 million citizens. Edwin, are you ready to come in?
Hello, Richard.
Hello, Edwin. Introduce yourself, what your role is in and your organization, please.
Okay, my name is Edwin Ohazurike. I'm a program officer with JONAPID, the Joint National Association of Persons with Disabilities in Nigeria. That is the umbrella body of all disabled organizations in Nigeria. Our case is still similar with a lot of other countries. The inability of the government to incorporate persons with disability, DPOs, in decision making as it concerns the COVID-19 situation. As at 4 June 2020, as of yesterday, the total case of COVID-19 in the country, according to the Nigeria Center for Disease Control, has risen to 11,516 with 335 cases discharged and a total of 323 deaths recorded. You can find those information at www.ncdc.gov.ng. Following the steps, the steep rise of cases in March 2020.
Could you speak a little nearer to your microphone, because it's a bit unclear what you're saying, Edwin? Thank you.
Okay, just like I say, around March 29 to 20, many states of the Federation had to put more effort in containing the transmission. But earlier in March 9, the Nigerian president set up a task force to coordinate and oversee Nigerian multi-sectoral intergovernment efforts to contain the spread and mitigate the impact of the COVID-19 pandemic in Nigeria. But painfully, as we can see, with no persons with disability as a representative in that task force. This is sad. I wish we had someone, a big person with disability in that task force who can coordinate effort to maintain disability components into the intervention of the task force. That would have been great for us. But it seems like that. Recall that in 2019, the Nigerian president signed into law the Discrimination Against Persons with Disabilities Prohibition Act, that is in 2018. And a lot of DPOs had to fight for more than 19 years to see this law come in. The act states that all public organizations are to reserve at least 5% of employment opportunities for persons with disability in Nigeria, with a fine of 1 million naira if contravened. The Nigerian Task Force on COVID-19 is not exempt from this. That means they have contravened this. And it is sad that right now, as I talk to you, the statistics, there is no statistics of persons with disability in Nigeria. There is no statistics of persons with disabilities that even are affected with this COVID-19. And it's sad that most of these DPOs don't even have the funds to conduct such a big research. We know that lack of reliable or no statistics on persons with disability in Nigeria to guide strategic intervention healthcare challenges is one of most of these issues that we are talking about. Increased gender-based violence are some of the problems, financial problems, lack of palliative provisions, unaccessible and inclusive information, lack of reliable or no statistics on persons with disability in Nigeria to guide strategic intervention makes the top list of the challenges and barriers people with disabilities in Nigeria are facing. But we are aware that the root cause of this challenge is the direct impact of non-domestication and sustaining implementation of all these policies, which is still what we're talking about. These policies that prescribe the right of persons with disability in Nigeria, even with all the advocacies that we have kept pushing, without any promising response from the Nigerian government to fully domesticate and implement these laws. So, for people with disabilities, all the general challenges that come up with the pandemic applies, but there are critical barriers that most of it is inclusive communication, accessible information. You know, getting information can be very more difficult for people with vision, hearing, and even cognitive disabilities, as popular news sources may not be accessible sometimes for them, especially when information is changing quickly. You understand? Keeping all of us informed is key to the COVID-19 public health responses. But information is not always accessible to the disability community, leaving us sidelined. This is what the Nigerian government have been able to do. A lot of advocacy has gone out from us to make sure that we are included, but that is very sad, and we can't get it. We can't get it done if it continues to be like this. Strategic information intervention should be provided for persons with disability to manage this crisis situation and to ensure that they receive timely intervention to receive their to reduce their poverty level through the provision of welfare packages and access to health facilities, even medical help. Most part of hello.
Yeah, we're hearing you.
Okay, most part of
you begin
Nigeria,
to wind up your comments. Thanks.
Okay. Most part of Nigeria, persons with disability might have received palliative measures, just few of them. But what about others that we can't even account for, we can't even reach? The Nigerian government is not doing anything, especially the Ministry of Humanitarian Affairs. They are not doing anything to break this thing down. Just like, but I must have to recommend Miss Ekaite more for her role and for all the things, the advocacies that she has been doing. She's been trying to reach out to the government. In most cases, I don't think, the last time I spoke with her, I don't think that there's been any feedback, good feedback from the government. What they do is just to do their thing, and there is no provision for persons with disability.
Okay, thank you very much, Edwin.
Thank you very much.
2 comments on that. I mean, well done on getting the legislation, but if it isn't being implemented, it's not really helpful. And of course, Article 11 has already been mentioned, emergency humanitarian situations, which this comes under, of the UNCRPD. One way to activate members of parliament is to do a sort of choose a certain day and get all your members who are online to send emails to ministers, members of parliament. They need to know that there are millions of you out there. I believe that you say there are 27 million at least in Nigeria. You need to make your voice heard on this one. People can do it from home, by telephone and so on, and use the press as well. So thank you for that, but we are with you in solidarity in getting more of a voice.
All right, sir. In ending, when you talk about statistics, you know,
Yeah.
the 27, more than 27, we say more than 27% because there is no statistics of person with disabilities in Nigeria. And
Well,
our advocacies, our advocacies, we've tried to build up a project, a program that is going to bring all the stakeholders together in a room and talk about it. Just one of the most effective steps we've taken before, but we don't have fundings for that. We wish that we can get funding and that can be done so that these policies and laws can be implemented.
I'm afraid sometimes you have to do it without funding. People have to just fight for their basic rights. Then once you get the organization, you may get funding, but we can talk off the meeting about that. Do give me a call. Okay, thank you very much, Edwin. I'd like to go to Steve Estey now from Canada, who's one of our, been with us since 2008. Steve is using the captioning service, but he's able to speak to us about what things have been like in Canada. It's been one of the big areas of pandemic and is still, as we said, in the blue zone when we were introducing it. So Steve, can I ask you to come in, please?
Okay, great. Thank you, Richard, for that. I'd like to start out by saying what an exciting time it is to sit here with people with disabilities from all around the world and talk about our issues. So I guess I'd like to thank Richard and Gem for organizing this meeting today. That's really quite a monumental thing to hear from people in India and Nigeria and all points in between. I think in terms of the situation of people with disabilities with respect to the pandemic here in Canada, the situation is very similar to what we hear in other countries in most respects. So I won't repeat that. The one thing that I think is different that might be of interest to people, the thing that's different here in Canada is simply that we have a government minister that's responsible for people with disabilities in our cabinet. And that person, who is a person with a disability herself, visually impaired woman named Carla Qualtero, she very early in the time of the pandemic struck an advisory committee of the disability leadership in Canada. So there was a committee of about 12 or 14 people who are the heads of major disability organizations from all across the country. And these folks meet on a weekly basis with the minister to advise her about the situation of people with disabilities on the ground. But perhaps more importantly, this committee is able to meet with other key government leaders in different areas, the Department of Health or immigration or what have you, to talk about the situation of people with disabilities in the context of the pandemic. So I think that, you know, this is a good practice that we have here in Canada that we would like to share with people in countries around the world. There's some writing that's been done about it, and I'm certainly happy to connect people within the organization to people who are more directly involved with this, if you're interested in it. I think that what we've seen is that through this process, we've been able to get the voice of people with disabilities into the decision-making around the virus. It hasn't translated into a lot of specific support right now, but we're hopeful that as time goes by, it will. And I think that, you know, we want to try and build on that and share that with colleagues in the Commonwealth to try and amplify the voice of people with disabilities in the process and the response to the pandemic. So as I say, I think that our situation is very similar in terms of the reality of people with disabilities on the ground. The difference is probably this advisory committee. So let me just leave it at that. And if people want to ask me questions, I'm happy to answer them either on the call here today or as an individual. If you want to drop me an email, I'd be delighted to hear from you. Okay, can we leave it at that?
Yes,
Thanks.
Thank you, Stephen. And it's good to hear that you've actually got your under the table of government, and even if it hasn't led to huge amounts, at least we're being listened to. Would you like to send us links to those more detailed documents about that, and we'll put them the links on the website so people can follow that up, and then of course people can link with you as well, but it might save a bit of time.
Yeah, sorry, Richard. Yeah, sure. I mean, I'm not sure what's been written at this point, but I'm happy to share it. And I'm also in direct contact with the minister's office, and I'd be happy to speak to them and see if we can share some of this best practice information through the website. And I guess also the other mechanism that I could tap into is with our Department of Foreign Affairs. We have a Commonwealth office in the Department of Foreign Affairs, and I'm in touch with those people as well. So I might make them aware of this call and of the interest of people with disabilities throughout the Commonwealth, and maybe we'll get some information flowing that way. Okay?
Yes, thank you very much. Okay, we'll move on. We have, I think, a clip from Thandi Mufolo from South Africa. I'd like to take that next, if I may.
Good morning, ladies and gentlemen. It's an honor to be here with you. Let me just go straight to the point around the impact of the COVID-19 or the trend that is happening. In terms of this trend, it has increased more in the SADC region, especially in the 4 member states, which is South Africa, DRC, Tanzania, and Mauritius. And those 4 member states represent 93% of cases reported in the region. While the COVID-19 pandemic threatened all members of society, people with disability are disproportionately impacted due to attitudinal, environment, and institutional barriers that are reproduced in the COVID-19 response. My question around this is to say, do we have a proper stats? Is there any report about issues that affects people with disability? Because when I pick up, the country only concentrate on gender, sex, age, and economy. Now, as people with disability, where do we feature them? Especially because people with disability, they've got what we call pre-existing health condition that makes them more susceptible to contract virus, experiencing more severe symptoms upon infections, and this leads to death. But even in the people that are counted in death, it's not clear how many are people with disability. There are awareness risks that leads to better response, and this can allay the impact experienced by people with disability. I think this guidance aims to bring awareness of the pandemic, the impact on persons with disability, and their rights. We need to draw attention to some promising practices already being undertaken around the world. Although they are there for general population, it's not clear for people with disability. We identify key actions for the state and other stakeholders. For an example, in South Africa, the disability sector, they are represented by Disabled People South Africa in the NEP center of the country, guiding the country around issues that affect people with disability. And this provides resources for further learning.
We've got one other person who was asked beforehand, which is Emil Gauss from Autism South Africa, and I'd bring you in now, Emil. That's the last of our speakers who were asked for. I've got a couple of others, one from Bangladesh, and then we'll take questions. So can we take you, Emil, next, please?
Good afternoon, Richard. And good afternoon, everybody. I hope you guys are well. It's a major honor for me to present today. As Richard introduced, I represent neurodiversity on a CDPF, and I'm also a NEC member of Autism South Africa. If I can quickly provide you an overview about the current situation, we've got around 100,000 cases in Africa with regards to COVID-19. Specifically in South Africa, we've got 40,792 cases in South Africa. Due to the rapid spread, our President Ramaphosa, announced on the 26th of March a national lockdown in which certain restrictions were raised and that limited social gatherings and contact. Individuals were encouraged to stay at home during this period, and this not only affected everyday citizens, it affected individuals, disabled people, and individuals on the autism spectrum in their unique ways. So how did the lockdown affect persons with disabilities or individuals on the autism spectrum? Well, as we know that autism requires different variations of support, and due to this, many are dependent on caregivers, and therefore, due to the rapid spread of the COVID-19 virus, caretakers must take special precautions to minimize the risk of the transmitting of the virus. During the lockdown period, individuals as well as families with children on the autism spectrum experience heightened levels of frustration and anxiety due to the break of routine and to the lack of support services available and appropriate engagement. Due to the communication challenges, persons with autism are also considered a vulnerable group when it comes to gender-based violence. So how did it also affect organizations to support these families, like Autism South Africa? As we know that Autism South Africa renders support service for autistic persons as well as families or caregivers. And due to the rapid spread of COVID-19, all basic services were restricted, and specifically all training and autism awareness events were postponed. In response to the COVID-19 pandemic as well as to the national lockdown, 8 of our big autism organizations in South Africa collaborated by sending a request to the office of the presidency in order to restrict the regulations. One of the recommendations were they wanted to ease the lockdown restrictions to provide access and to support families by providing access to facilitators, to support caregivers, and order for funds for social relief and to participate in feeding schemes. There was also a request to reopen care centers to admit autistic people in distress, as well as to support families. There was also collaboration with our umbrella organization, the South African Disability Association, SADA, and we worked on a disaster management act in response to this national lockdown, in which certain themes were basically discussed in a draft document. One, as such, to provide you an example, was the access to information on communities, reasonable accommodation, access to relief funds, universal access, evacuation plans, personal assistance, and general provisions. Our neighboring country, Namibia, to refer to their current situation, they have currently 25 cases. Their OPDs and their NGOs are working well together. but they're also dependent on a loose organization called the Disability United Network, which also shares their difficulties during this difficult time. Although they admit there's lots of work still to be done, you know, they also make use of documentation from the World Health Organization, as well as the UN guidelines regarding the COVID-19 response. By using these, they promote individuals as well as parents to keep their distance, encourage to wear masks, hygiene, as well as the washing of hands. To conclude, I want to elaborate on the following fact that South Africa has unwritten in its constitution, Article 25, which states that all parties must recognize that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. Article 11, parties shall take, in accordance with their obligations under international law, including international humanitarian law and international human rights law, all necessary measures to ensure the protection and safety of persons with disabilities in situations of risk, including situations of armed conflict, humanitarian emergencies, and the occurrence of natural disasters. Yes, we still have lots of work, but you know, like Richard said, you know, it's up to our self-advocates as well to encourage, as well, to ensure that you know, that our voices be heard, and to ensure that, you know, all individuals living with autism, as well as disabled people, to be accommodated in all aspects of society. Thank you.
Thank you, Emil. And we're sort of getting to the end of this general presentation. I've seen someone from Bangladesh wants to do 2 minutes.
Bhawani, Persad, Trinidad, Pavi, Trinidad and Tobago.
Okay, yeah, you go on then, briefly. 1 minute.
Yes, briefly.
Okay.
Okay, the Caribbean has been blessed because our level of caseloads have not been significant. In fact, the highest caseload in the region is in Jamaica. Most of the other islands have gone under 200. Trinidad and Tobago per se, we've just had 117 cases with 8 deaths. Most of the other islands have between 11 and 15 deaths for the most. So we've been blessed by that. We're working with all the government agencies in the respective countries. We've been given updates via the news media, etc. So all in all, our region has been spared the wrath of other agencies and other countries in this current pandemic. We are, as I said, working with our governments, and the governments are trying to do their best to you know, bring relief to persons with disabilities in some form or the other.
Okay, that's really useful. You'll get a chance in the groups we're going to break into in a minute, Caribbean and Small Island, to talk about some of the issues. And let's remember, we aren't out of the woods on this yet. There's no vaccine as yet. And the idea that the best research will lead to it, there's still not a vaccine for HIV/AIDS. That just gives you the scale of it, which is another coronavirus. And so, you know, just because a lot of it is going into it, so we may be into this situation for a long time. The speaker from Access Bangladesh, Mohi Paul, bring you in on this.
Thank you, Richard. Thank you, Richard. This is Albert from Access Bangladesh Foundation.
Okay, go ahead, Albert.
Thank you, Richard, and thank you, Commonwealth Disabled People Forum, to organize this important virtual consultation. I think the previous speaker, the experiences are similar, but in Bangladesh, you know, there are 2 disasters we are passing through. One is the COVID, and another one is just super cyclone Ampan. Yeah. So, you know, the people with disabilities are at high risk. Particularly, they are at risk in terms of health, and economical risk is very high. Okay. So I just want to give you a few aspects. Mm-hmm. You know, there are, at this moment, the cases are increasing day by day, but since 25th of March, the countries are at lockdown situation, but the government very recently on 30th of May, the government decided to reopen at a very small scale. But we know that the situation is very worst now at this moment in Bangladesh. So if I say very categorically, the people with disabilities, this is also the unreported information. 3 people with disabilities are died with COVID symptom. And at this moment, there are 2 cases, infected cases with disabilities, people with disabilities. And if I say very specifically, you know, the accessibility, inaccessible information related to the COVID situation is also in our country also. And also due to lockdown situation since 25th of March, so the many people with disabilities, and many people, not all people with disabilities, those who are involved in livelihood, I mean small business, they already lost their business, and many people with disabilities are at this moment, they are staying confined at home. Mobility problem due to limited, you know, travel, due to restriction of the government on travel. And, you know, this is very similar with other countries that the general health service, this is not people with disabilities are not able to access into general health services. And also, you know, the country, they just started in a very small scale on online education system, but people with disabilities are not able to access because their aspects and their needs are not addressed. So if I say the overall situation, you know, there are 2 types of facilities government provided during lockdown. One is the cash support and another one is the food support for extremely poor people with disabilities. Cash support, actually, there is a policy level barrier in Bangladesh. Government decided the people with disabilities should not be included in the cash support. The logic is, you know, the government is telling that the people with disabilities are receiving disability allowance, but this is a very, very minimum amount, $7-8, you know, in a month. So in the name of disability allowance, government is telling that people with disabilities, they shouldn't get the, you know, emergency support, which they started during COVID. So this is the really very bad side for.
To wind up, please.
Yes, yeah. So the main things, okay. So the situation of people with disabilities are really worst in this situation. So we are continuing our advocacy with the government. So let's hope for the future. Thank you.
And if you could, I don't know if you've sent in the survey report, and that goes for everyone on the call. I will get Gemma to send out the survey to everybody. We've had, as I said, about 22 in, but we would really like more filled in over the weekend. And we don't mind more than 1 from each country if you have a different perspective on what's going on. So keep those surveys coming in. Okay, now is a time for points and questions, but these are not a chance to do a whole report on your country, but a specific point. If you put your point in the chat room, I will look at it. The chat room is down the bottom. You just click on it and you are typing it to everybody. And you just, when you have put it in, you just press the return key on your keyboard and that will put it up for everybody to see. Okay, Ali, you've been indicating for some time, 1 minute on a point from Mauritius. We heard earlier on you have a high rate again now. So what's going on in Mauritius?
Hello, thank you, Richard. Hi, everybody. So here in Mauritius, the lockdown is over. Mostly, we have to wear the mask mostly of the time. It's compulsory. But the issue arising for people with autism and Down syndrome, because it's very difficult for some people with autism and Down syndrome to wear the mask. So we are making a request from Ministry of Health how to handle the situation. Hopefully, we will get the answer very soon, but it all depends upon the medical advice. So we are no longer in lockdown. We don't have to or nearly all the offices are on, but the school is still closed. It's still the same thing everywhere, where the distance learning is an issue because of the internet connection. Not all people are able to have the internet connection, but I can say we are not that much safe, but we are okay here in Mauritius. Thank you.
Okay, thank you, Ali, for a short report. I'd just say on the question of masks, I mean, the UK government has today, having fought and said we won't wear masks because they are saying it's now compulsory to wear masks on any public transport from next week. We've had issues from deaf community about masks, and you can get masks with a transparent part for your lips so that people who read lips can actually see your lips. So that's something that people should maybe be making as a demand. If they are putting forward compulsory wearing of masks, it's not just those people with intellectual difficulties who have a problem with masks, it's also people with breathing difficulties, but also the deaf community who often need to read each other's lips. So we can ask for these transparent masks to be brought in. Thank you. Prasanna, do you want to say something about Sri Lanka?
Not really. I think things are pretty well covered with the Asian, South Asian presentation. In the Sri Lankan context, we have been going through the same. Most of the speakers have brought it up, but a new development is the general elections, which was scheduled to be held in 24th of June. It was basically so many people have gone to the Supreme Courts asking them to change the date, but now we are expecting that to be happen probably in August or September. So under medical guidance for voters and the election process. So it's a new experience, and we are now in the process of putting out guidelines under COVID, how the voters with disabilities should, how to tackle the person with disabilities in this context. So that's the kind of dialogue which you have risen right now. So we are working on that area, Richard.
Okay, thank you for a brief report there. Wong from Malaysia, do you want to just update us? We've picked you up as something that you've gone right down and your numbers seem to have gone up again. Is that having any impact on disabled people in Malaysia? Do you want to come in?
As reported by Richard, the numbers in Malaysia not too high, but it's still above 10%. Mainly now we have a lot of issue with foreign workers, but among Malaysian citizens is getting down. We are now thinking of coming out of lockdown. So there are a lot of discussion on how persons with disabilities can be protected and how we can help them to restart, because during lockdown, all economic activities have stopped. For example, a lot of them are like working as masseurs, street musicians, and also small businesses. So this, just 3 hours before this meeting, we have an address by our Prime Minister, and we are happy to note that he has said that the government will provide 1,000 ringgit, which is about $250 per month, for employers to hire persons with disabilities after this, when the economic reopen, which they have not announced yet, very soon we hope. And the government also will give one-off financial assistance to nearly all persons with disabilities. And also there are a lot of programs to scale up and for training and to change the way we work. So a lot of money is poured in there. Just now I heard about people talking about lack of internet connectivity. So in Malaysia, we have government is giving 1 GB of free internet every day to everybody, so they can do their online education, they can do their online meetings, jobs, and etc. etc., etc. So we are not out of the woods. We are not out of the woods yet, but we are hoping that we can restart our economy.
And we did pick up on that, you know, the Malaysian government is more supportive than many on this issue. So well done on getting that.
Yeah, Richard, but I have a question for which I put at the chat box. Social distancing. I just want to know, in other countries, do persons with disability experience any kind of public shying away from assisting persons with disabilities because the government is encouraging social distancing, 1 meter, social distancing. So you cannot be assisting a person with disability from a distance of 1 meter. So any ideas or sharing from others? Thank you.
Yeah, that's something we picked up from around the world, that for instance, if you need to hold someone's arm, if you're visually impaired, to walk and so on, then there isn't an issue unless it's someone who you are with in your household, and therefore they count as part of someone you can have contact with during the lockdown. However, in the way that there's been a dispensation for lockdown for people who have autism and other learning difficulties, these have been agreed. But of course, there's then public pressure if they see someone with you. So some sort of badge or pass that people wore would be a useful thing to have to put to government to deal with that. I think we're going to go into the regional groupings now. Can I just explain why we're doing this? We have changed the grant that we got from Disability Rights Fund. As you know, in 2 weeks' time, we were going to hold a conference in Rwanda at Chogum, but of course that's been postponed, put off, and the funder will not support anything where people meet face-to-face currently, and so have supported us in setting up this network and supporting us in what we're doing. One of the next things that we want to do on this is to introduce people into regional groups so that you can all get a chance to talk to each other about what the issues are. And in a minute, Gemma is going to put you into 5 groups. This is Southern Africa, Caribbean and small islands, East and West Africa, 1 group, and Asia, and then Europe, Canada, Australia, New Zealand if they were with us, but they're not. In other words, the more developed countries. I'd like you to, we have said to people who we're putting in those groups, but they're not all on the call, could they facilitate it, make sure everybody has a chance, nobody talks too much, introduce yourself briefly to each other. What happens, you get into a room, we allocate you into a room, you are still on your screen with your video and your microphone, and you can introduce yourselves, and then we'd like you to go around the group. We'd like you to appoint someone to be the spokesperson to keep a note of what is being said in the group, and then report back your outcome of your thinking. And the things we want you to look at is, what are the key barriers and issues? How should these be resolved? And how should issues be taken forward, particularly these issues, the longer term issues of unemployment, education, the gaps that are going to impact on people for a number of years from this pandemic, and also how do we get our voice more into government in our regions.
We have discussed that they should be able to give them more attention when it comes to health issues, because they have even underlying conditions.
Yeah.
And education also, they should be able to reach out more to them, because they have even more special needs as far as education is concerned, and the accessibility to the internet learning that is happening now. Okay. Yeah, we were not able to finish. Thank you.
Well, that's okay.
Thank you.
We're going to convene these groups for everybody who's on the call. We'll send out a list of dates and times for these regional groups to meet for a longer period, so that you can feed back into what we're doing. It's part of our work plan that we do this.
Yeah.
Okay. Thank you, Sarah.
Okay. That will be better.
Right. So the next person is Southern African group. I think that was you. Was it you, Emil? Reporting
yes,
on that?
yes. Yeah, right. It was me.
If you can be brief. Thank you.
Yeah, I just say, yeah, we didn't conclude the session, but from the basic aspects that we could basically talk about, and what I can gather is that if you look at political as well as humanitarian situation, we believe that that persons with disabilities are not accommodated in all aspects of society. If you refer to education, all aspects of society, and due to the fact that some of our countries are in national lockdown, these persons with disabilities are not accommodated, it's in terms of financially as well. Economic, and the thing is that what I could gather is that we do not we do not have due to national lockdown, we do not, our ministers as well as our people in government, do not support us in the way we needed to be supported financially, as well as in terms of the documentation that needed to be drafted in order to support our rights. So I think that was one of the main aspects that we spoke about.
Okay, thank you. All of those reporters, if you've got notes, if you could just type them up and send them in an email to me, rlreeser@gmail.com. Thank you. There is a reporter from, did anyone take notes from the Caribbean Small Island Group?
Yes, certainly.
Okay, bhawani, can you give us a report on that then?
Okay, there were only four countries represented from this group. We had Guyana, Barbados, Dominica, and Trinidad and Tobago. Yeah. We learned that most of the problems are quite common in the region. Education, there is a big challenge in that because only 1 or 2 persons or schools were able to participate in online learning, a big problem. Many of the schools, particularly in some countries, given the internet challenges, were not able to participate. Health, we only had, unfortunately, 1 person with disability who passed away in Guyana. But otherwise, generally, we had no other cases. Well, we had 1 case in Dominica, but he recovered. We learned that in Dominica, there is the granddaughter of a person with disability who is heading the disability ministry division in Dominica. Basically, employment, our Guyana colleague was optimistic that there could be some positive moves in this direction. And in Trinidad and Tobago, we submitted to our Road to Recovery committee a document outlining all the facets of education, health, etc. And we have received a positive response from the government appointed team. So
it'd be good if you could share that with us, that document. It would be useful.
Sure, no problem.
Okay.
So basically that's it from the Caribbean.
Right.
We have 1 complaint that one of our colleagues was sent to Asia. I don't know why.
Oh, okay.
Excuse me.
That was my fault. I'm so sorry.
Sorry.
We'll get it better the next time.
Correction. Hi.
Just one correction.
No, we have there was no cases. There were no cases for persons with disabilities in Dominica. No.
Okay, no case.
No case.
The person was negative.
So you're doing very
He
well.
was negative. Yes.
We had no cases in Trinidad too. And no, in the
no
Caribbean,
cases, no deaths. No deaths at all in Dominica. No cases.
Okay, very good. Well, thank you for that. Then we'll go to the last group, which was the UK, Canada, Malta. Marthi's from Malta was going to tell us the main points they came up with.
Yes. The salient points of our discussions were 3: independent living, that the government needs to restart thinking and working and funding for the independent living of persons with disability, the need of more integrated transport everywhere and in all countries, and that the government needs to start as soon as possible implement the UNCRPD.
And I think as I was in that group, I'll just add the point about independent living. It was a point made from Canada, which we agree with from the UK, and I think Malta, was that the death rates in institutions, particularly care homes, which are largely inhabited by disabled people, whether they're elderly or homes for disabled people, are much higher than in the general population. And this is an argument to move for independent living and deinstitutionalization. And I think it's a good point to take up everywhere, which of course is Article 19 of the UNCRPD, that we shouldn't be being put into these institutions. We should be supported to live in our community. And so I think the answer to a future epidemic with these high death rates is to say, well, close them down and give us the support we need. Okay, we're coming to the end. I just want to put up one last thing, which is here.
Richard?
Yeah.
Just before you do, I seem to have created a different group that no one was quite sure about, which is completely my fault. And Juliet has asked if she can feedback from that group. I'm still confused as what group that is.
I've got a minute, and if she's got a minute, that's fine, right? I've got my slide up the way forward, but...
So Juliet, please.
Yeah.
We'll be very quick.
Yeah.
Just the starting point of any issues to be, or any resolutions going forward is the CRPD, and the governments need to be held to this because it's been totally neglected in most of the countries. The disability voice has been neglected in any COVID responses in most countries that were in this group. And the lack of unity in the disability sector is also an additional barrier. So if disability organizations and groups could band together with a stronger voice and then hold governments accountable to the CRPD, particularly Article 19, if emergency procedures had been in place, we would have had a far less detrimental outcome of the COVID pandemic. That's short and sweet from us.
So where are you from, Juliet?
I'm actually from South Africa. So we were from Malawi, South Africa, Mauritius, and the fourth person unmuted or muted themselves.
Okay. Right, thank you for that, for reporting on that. I think we've covered everybody. So thank you. I think it's been a constructive dialogue. As I've said, if you haven't sent in the survey, please do. I'll get Gemma to send it out to everyone who's on the call.
Richard.
I'm putting this to everybody, so we'll get back to a full, if everybody puts their screen on the end, we'll take a vote on this, but I'm putting forward two resolutions really, that we call on the Commonwealth Secretariat and the Foundation to hold an emergency Commonwealth COVID-19 summit to develop plans for future, including disabled people. That's the first point. And the second is, as Gordon Brown, ex-British Prime Minister, has been saying, in light of experience under the banking crisis, where he largely managed on his own to get the G20 countries together, it says call on G-20, it should say G20 Summit on Recovery and Resilience to COVID-19, based on the principles of human rights and in the UN CRPD. And that particularly is important to people here from the UK, India, Australia, Canada, the EU. So that's Malta, to lobby the EU, and South Africa. So they're all permanent members of the G20 to hold a meeting urgently in the next month or so to actually address this. The problem we have around the world at the moment, and we passed a resolution, which you can see on our website, the last one of these, calling for an international response to all of this, is instead we're getting a countrywide response. And we need to bring all the nations of the world together. And these are the most powerful nations, including Russia, China, and so on, South Korea. But these are the Commonwealth countries who are part of the G20. So that a fund can be put aside for the redevelopment of countries' employment, the technology that we need for us as disabled people to be part of that recovery, and to put in plans in place so that if a further pandemic occurs, there is much more cooperation in the world to deal with it. Many of the epidemics that we've had have been because people ignored the World Health Organization advice. In fact, you had the President of the United States arguing strongly against it, as you did the leader of Brazil, and that's one of the reasons why those are two. And Boris Johnson very late getting in on it. Those are the three countries with the highest death rates: United States, UK, and Brazil. So there is a real need for international unity, and that's why I'm putting this forward. That we, from us as an organisation, will put this to governments. But I'm also asking for those countries that are part of the G20 to lobby their governments directly. And Steve's already said that he has a link in Canada to that. We've heard that from India that they've got links to government. And I believe from Tandy, she said also there was a link. So we need to use these links to push government to lobby for this G20 meeting, and within the Commonwealth to press for a Commonwealth summit. Do people agree with that as a suggestion? You could push, if you do, at the bottom, you've got a button where you can, or you can just raise your hands on the screen if you like. Can we see everybody?
I absolutely agree. I don't know where the button is, sorry.
Okay.
Richard, maybe you could stop sharing your screen.
Oh, yeah. If I stop.
Yeah, I agree. I agree with your
Richard, I'm
suggestion,
sorry. I don't know how to do what you're asking.
Okay. Well, just...
I agree.
We'll go around. Everybody. Anybody disagree? Anybody disagree? So is that a unanimous agreement of everyone on this call? Can I say that?
Yes.
Okay.
Agree.
So we'll have to end now because we have terms and conditions for our captioner and our signers, and therefore we have to stop. But I think 2 hours is about as much as most people can take anyway. I think it's been a successful meeting. Please send in any policy documents or press that you've got, which is positive, we can share. We do have one, Michael Njanga from Kenya, people with mental health issues, was going to speak, but we have a document that they have produced, which is also going up on the website. So I think do look on the Commonwealth Disabled People's website under the COVID section. There is a lot of resource there, and we're going to build it up from this. We will summarize what's been said on this call, plus the questionnaires that have been sent in by the end of next week. And once we've done that, we are seeking a meeting with the UK government, DFID, and the Foreign and Commonwealth Office and the Commonwealth to put these points across. But ideally, given what we've agreed, we want to push for a G20 meeting to get a global strategy to take us out of this pandemic. Thank you very much. And you can all wave goodbye now or say goodbye, and we'll leave it there. So thank you very much. Bye-bye.
Bye-bye. Thank you.
Bye.
Bye.
Bye-bye.
Bye-bye.